esophageal atresia. Okay, so it's tracheo, we call it TE Fistula, tracheoesophageal fistula. So when kids, usually this is the anatomy. You have the trachea here like that. The esophagus is behind it. So you run here and you go into the stomach like that. In certain kids, unfortunately, you have this is happening. The esophagus doesn't mature. You have just a atresia halfway, and the distal portion form a fistula like that, and you go into the stomach. So you have atresia of the esophagus, and you have a fistula here. Fistula means there is connection, and this is the trachea. Trachea is the breathing tube, and this is the esophagus. So when the kid taking anything by mouth, what do you think? It can't go anywhere. It stay here, and nothing goes into the stomach. And what will happen? The kid will aspirate and go into the lung, and therefore you can figure out the symptoms. This is all you need to know, and you can figure out what kind of symptoms they're going to have. And this is the common type. They call it the H type. You don't need to worry about it, but just know, and it's found in newborn kids. So when a kid has a saliva, okay, they have a fruity saliva. Okay, it can't go anywhere. They can't swallow their saliva. Imagine you swallow all the time. No, this kid cannot swallow. The saliva stay there, and then it start coming out of their mouth. So they have like a lot of them, and then they will be choking, okay, and coughing all the time. They will be choking and coughing, which is not good, right? So what should be your number one problem for this patient, which they will ask you priority action for a kid with tracheoesophageal fistula? Well, aspiration. So that's your priority action. That's all you care about. What do you think? If I have a lot of sputum, I can't get rid of it, saliva, then the kid will be drooling. Okay, that's the B-sharp symptoms. They will be drooling, they will be coughing, they will be choking, they will have fruity saliva. All these things is a problem. And when they aspirate, they will have cyanosis. They become apneic. And that's what you pay attention to. Feeding is no, negative. Like you hear me say, negative. If you feed a kid, you go into the esophagus and it go back into the lung. And that is the first signs they see. They don't know that the kid has tracheoesophageal fistula. They try to feed the kid and they start choking, coughing, drooling, become cyanotic, and then they have fruity and saliva. And then they will realize that, oh, there is a problem. If they trick you, this is advanced level. If you put the NG tube in, it's going to coil. So coiling of NG tube is a good sign on the chest X-ray because it can't go anywhere. It will just stay there. So your priority action is this. Prevent aspiration as much as possible so you don't feed the kid, and you have to protect the airway. So what is your treatment? If we can't feed them, they keep them NPO. Just give them some nutrition, okay? And some IV fluid, right? And that is all you need to do as the nurse. Make sure the kid is NPO, is getting some nutrition and IV fluid. Nobody is feeding the kid, and you're watching for aspiration until the doctor comes and fix the fistula. This is need surgery to fix it. And that's all. That is everything on tracheoesophageal fistula. That's all you need to know. The signs and symptoms, what is your priority action? Look for prevent aspiration. And what is your treatment? Is NPO, TPN, IV fluid. What intervention you need to make sure nobody feed the kid. What signs would you see if you put the NG tube in? Is going to coil in the chest. And that is what you have to pay attention. Okay, any questions so far? So If no questions, another topic that is very you have to know cystic fibrosis, and I think it's my favorite because it's a cool thing. It's both respiratory problem and a GI. So I will talk about all of them, and then you can use both in addition, right? What is the major problem? This is a problem that you pass on from mother to, and both the mother and the father is involved. Is autosomal recessive. So you have to like both parents have to contribute. And what is the major problem? They cannot control their salt. Sodium chloride channel is affected. So they loses a lot of salt. See what I'm doing? I'm trying to make it easy. So they loses a lot of salt. Based on that, if all the salt in my system is lost, every fluid that I have is going to dry up. And that is all you need to know. That is the pathophysiology. And you can take it to anywhere you go, you want, any system. The two systems that is affected is, this is what they have. The common area of your body that use a lot of fluid and secrete things is the pancreas. Is the major thing that secrete a lot of exocrine product, and that help with digestion. Your lung is also secrete a lot of stuff. And so that's why this is the areas that is affected really bad. Their secretion is going to be thick, thick secretions. Very thick secretion, and that can block things from working. So if you take the pancreas, for example, all the secretion will be thick. So nothing comes out of the pancreas. And therefore, all the things the pancreas does cannot work. If you take the lung, the same thing, right? The lung, they cannot secrete their secretion. And so it's very thick. So you got to help them to break it up. So when they ask you a question, think about it. The main problem is their secretion is thick, so I can't get rid of it. So I need to help them get rid of it. So since we're talking about GI, let's talk about the pancreas. Okay, the pancreas cannot secrete anything. So the secretion is very thick. What do you think is going to happen? They cannot, the enzymes that is used to break fat is from the pancreas, to lipase. So they can't have all those enzymes to break down fats. And so what is going to happen? They're going to have problem absorbing fat vitamin and dependent. So A, D, E, K are the vitamins that depend on fat absorption. So they can't do that because they lacking all the enzymes needed, right? And then they're losing a lot of salt. And you know, whenever you hear about salt, think about dehydration. So they're losing sodium, and then they're going to lose a lot of water. So there will be a lot of some teaching here that you get to tell them to pay attention to. There have to be a lot of teaching we have to do. And that is what the exams is going to be on. We've talked about the main thing. I can't secrete my enzymes for fat breakdown. My secretion in the pancreas is thick. I'm losing a lot of salt and water. And this is the main problem, without even talking about the lung. Even if I have the lung to it, I can't secrete my secretion. So my sputum is so thick, I get recurrent infection. So they have like recurrent infection. And that's how you can use that to answer your question. So for the GI portion, this is what is going to happen. Okay, number one, you got to give them some salts. So some salt tabs to help them. Okay, these are teaching that you see in the SATA. If I'm going to lose a lot of salt, well, don't go out when it's sunny, right? Stay out of the sun. It doesn't mean they cannot participate in sports. It's okay, but don't do when it's too sunny. See, don't do that. So don't do that. They shouldn't go out when it's sunny, right? They need to drink a lot of water because they're going to be dehydrated. Drink a lot of water. because they're losing salt. And then, like I said, avoid hot weather. That's very important, right? And for the pancreas, the enzymes, you need to replace it because you cannot break down your fat if you don't have it. And because they don't have it, you can think about it. Their stool, what do you think their stool is going to look like? A lot of stool, large, liquid, voluminous, whatever you want to try, fatty, floating stool. You know, it's just like basically it's consistent with the problem they are. They cannot absorb fat. So that's what you see. And then let me clean this. And then what is going to happen? Well, they need that vitamin. So you got to supplement it, vitamin, fat soluble vitamin, ADEK. They need some so that they can function properly. This is their major problem. The kid eat, everything comes out. Eat, everything comes out. So they need, like, you have to nutritionally support them. They need a high calorie, okay? Right, a lot of protein, fat. Otherwise, they won't grow. They're usually very small to gestational age. So they're very small because they cannot absorb anything. It's so sad, you know, because of that. And you have to help them to give them a high calorie, protein, fat diet as much as possible. For the chest, what do you think you need to do? Physiotherapy. Okay, that's all. Chest physiotherapy, that will help them. And don't do this after they eat. So you got to come up with a plan. What is the best way? Physiotherapy means I put you on the flat and I bang your chest on the back side. So it's like drumming. You drumming the back of their chest to break all the mucus. So you don't want them to. You have to do this. So you do this before they eat. Otherwise, then they will aspirate. Okay. This is just something you have to think about. If they trick you, they put it in the question. Just be careful that you don't pick it. They will trick you with that. Okay. Before eating, you do chest physiotherapy. Okay. And so those are the major things you need to know about cystic fibrosis. Remember, the stool too need to come out. It may be really insipidated, very, very thick. And so you got to help them. You got to help them out there. So they need like a bowel regimen, aggressive one, not like little ones. Okay. So aggressive bowel regimen. So these are all the things they put on the satellite, but you have to think about it. Look at all the things we talk about. He has a bowel problem, they have chest problem, they have diet problem, they have pancreas, they have growth problem. They need a social support. So sometimes social services has to help the family to take care of these patients. And those are the last thing I want to say is the vas deferens. This is something that drain the testicles, the sperm tube, basically. And so these people, their vas deferens is not developed. So they cannot have baby. And that's the major problem for these people. Okay. Peds GI, you know. The other small ones that is left is like this one, necrotizing enterocolitis. Just a few words about it. It means it's usually found in premature baby, so preterm, okay. And the name is from the diagnosis is from the name. It's necrotizing, so it's dying. Something is dying, so necrotizing. Enterocolitis, that means colitis of the small bowel. Right? So that means of the small bowel. So necrotizing enterocolitis of the small bowel. These kids are very small. They preterm. The bowel is not developed. So small bowel is underdeveloped. Okay, it's very underdeveloped. And so they try to feed them. When they feed them, initially, they don't know. And what happens, the kid gets sick. They become septic. And so you have like white count goes up, they have fever, and blood pressure is low. And then the bowels start to die. And the best way to see it is look at their abdomen. The abdomen, because the kid is premature, you can see the bowel, small bowel moving through. And so they have erythema of the abdominal wall. This is the classic. This is what you need to know. That is the classic symptoms of enterocolitis, this one. So abdominal wall, you see, if this is the abdominal wall, you see like erythema. You can see the bowel through, everything look like blue. And that is the whole thing. The kid is young, is underdeveloped, they're feeding the kid, they don't know, and then the bowels start to die. And then when you look at the abdomen, they are distended. So the abdomen will be distended. And then you see erythema. So in your test, they're going to ask you, what do you do? Remember, key thing, anything in the GI tract, if you're sick, if the GI tract, whenever you're sick, and even if you don't know any answer that you're supposed to choose, make them MPO. If I'm sick in the abdomen, first thing you can do, make them MPO. If I'm MPO, you need to resuscitate them. So you give them fluid. If I have infection, you give them antibiotic. And this is the theme you got to keep on thinking about. All the GI pathology, if you have cholecystitis, pancreatitis, everything, because they're sick inside, they need to be MPO. If I'm MPO, giving some IV fluid. If I have IDs, giving some antibiotic, and the rest, figure it out. So this is what you do. MPO, IV fluid, antibiotic, and wait until the kid gets better. Sometimes they don't get better, they get sick, and then they go to surgery. And that is the everything about necrotizing enterocolitis. Straightforward. The last one I wanted to talk about is Hirschsprung disease. It's very straightforward. So you have the colon. So if this is the stomach, okay, you have the small bowel come, and then you go into the colon, okay, like that. These people, their bowel in the rectum. This is the rectum, okay. They need something to allow the rectum to relax. The gangrene, they're mixing some gangrene here that involve in motility of the rectum, but they don't have it, so they lack in it. And so what happened is that area of the rectum doesn't move. So lack of gangrene cells, it doesn't move at all. Therefore, these sphincters that they have, it cannot relax. So no relaxing. So what happens is the proximal bowel become like big, and it acts like a valve. So the colon is all dilated. And that is what you have. That is all Hirschsprung. Basically, non-relaxing of the sphincters. And therefore, you can see that this kid will not pass any meconium. It can't pass meconium at all. So no meconium. So meconium negative. So no, they're not going to pass meconium as soon as they're born. Within 48 hours, they can't pass it. And then they get really distended. The colon is all distended. You can see nothing is going here. This is obstruction. So all the proximal bowel will be distended. If they vomit, it's going to be bilious, right? Because, I mean, it passed the small bowel. And this is all they want you to know, that you have a distended abdomen, you have a bilious emesis, the kid has not packed meconium. And they're completely impacted with stool, so stool impaction. What they need is colostomy. That's the treatment. They will need surgery to fix it, so they will need a colostomy to do that. And that is all. This is the Hirschsprung disease. And that is everything about GI pathology. This is all, everything about GI pathology.